And integrative medicine, the story of integrative medicine is very similar. A lot of people called it alternative medicine many years ago. So it was like either you go to your doctor or you do this. There was no in between. It was just black and white. Then we talked about something called complementary medicine, so kind of warming up to the idea that there's more than just the Western medical approach. Integrative medicine is about combining best of Eastern, Western medicine in a scientific and in a safe and effective manner. That's what it really is. All the therapies we're talking about in the world of integrative medicine have been validated by science and have been around, some of them, for thousands of years and a part of cultures across the world. So instead of practicing in isolation, we're not saying do this or this. We're saying we're doing this and this. So it's really bringing a whole new set of toolbox, to our patients to not just treat conditions and diseases, but also keep them healthy. So that's what integrative medicine is all about. And that's sort of what gets me up in the morning, keeps me going for hopefully for years to come. So
I love that.
That's awesome. When I hear about that, the term that I grew up kind of familiar with is holistic medicine. I don't know if you can touch on the differences between holistic and integrative medicine, if they're pretty similar.
They're very similar. And I think holistic really nails one thing really well, is the word holistic really emphasizes that it's not just physical health, that it's more to just the body. There's also mind and the spirit. So I think about holistic medicine as just addressing not just the physical symptoms, but also bringing into the conversation about our mental, our emotional well-being, and our spiritual well-being as well.
Yeah, I really like that. As you talk about this, I kind of think about traditional medicine and the role that is played in basically what America is today, right? I think you touched on it. It's very much like you go in when you're sick and then they try to give you some sort of pill or cure to like reverse that. I really like this idea of integrative medicine, I think specifically because it kind of makes it more accessible. I feel like with regular medicine, it's very like, what's the word? Safeguarded or like behind a wall, right? And the doctor is the one that administers it to you, and you have to trust the doctor, right? And whereas in this case, I'm guessing you probably equip people with the tools and the things that they need to be able to address things on their own and be able to say like, okay, this is what I need to do if I want to feel better.
Yeah, exactly. And a lot of the work we do is really helping people understand and get to know their body better. Because I think we are still in that mindset. You get sick, you go to the doctor, you get a test, and the blood test is telling the doctor what to do instead of the person. So that's the reason why, people always ask me, do you treat thyroid? Do you treat chronic fatigue? Do you treat gut health? What do you treat? I always say I don't treat any diseases, any symptoms. I treat people. Right? Because two people can walk into the door with the same exact diagnosis or symptom or a label, but how I approach them, their story, the story of their symptom or their illness is always completely different. So that's why I think we need to open our eyes and say, yes, let's look beyond the labels and the diagnosis and understand the story and create the treatment framework around that, because then you'll get real success rather than just one size fits all approach that Western medicine often embraces.
Right. I mean, we're just barely into the beginning of this conversation. I'm already so excited and grateful for the work that you're doing, because I think this is just something there needs to be way more conversation and awareness around. I feel like the way that we've done medicine in America for a long time has been kind of stuck. And, you yourself just mentioned thousands of years of these types of healing being practiced across the world. And like, I feel like we're so far behind in a lot of ways. And in some ways as a country, kind of got this big idea of like, oh, we're the smartest, the best, the biggest, the baddest. And there were so much that developed and came out of that is so important and necessary. But I think in the race of that, there was so much wisdom left behind. And so to know that there are people like you out there that are doing this integration of the two is so incredible and important. I grew up with a mom who had this big old book called The Prescription for Nutritional Healing. And so when you mentioned your grandmother, and it's like when you're sick, it's all about food. Like I almost never had medications growing up, you know, if I had a cold or this or whatever. And still to this day, I rarely do. If I, you know, there are certain things that my mother taught me when I feel a cold coming on, that I make this tonic and I start drinking it, and I kind of avoid getting the full bust of it, you know. So I'm really grateful that I had a mom who was smart and was doing that, and you had your grandmother who taught you all of that. I didn't take it and go to a prestigious school and become a doctor. So kudos to you for doing that, because it is necessary. And do you find when you're bringing these ideas to patients and to people, do you find a bit of resistance and like, oh no, this isn't the way it's meant to be, and wait, I need you to do something else? Or are you finding that people kind of heaving a sigh of relief, like, oh my gosh, now we're going to do something about this and get out of sort of that revolving door that you mentioned?
Exactly. I think it's the latter all around because, you know, typically, you know, when I see a new patient in my office, right, I spend at least an hour with them. And during that time, we're talking about not just your checklist of what allergies you have, what medications you're on. Yes, we do that. But a lot of time is spent in just saying, okay, tell me, what is your goal? You know, what does health look like to you? What are things that bring you sense of joy and happiness? So we're talking about
Well,
things that
just
no
like
one has.
pause you for just a second. Just the fact that you saying you're spending an hour, like, that is blows my mind, because usually it's just like so fast, get in, get out. What do you got to do? You know, and there's a lot of pressure on doctors. I don't want it to seem like I'm like digging on doctors, like how dare they not spend more time? Like, it's high demand, and the expectation of what they're supposed to churn out every day is intense. So just the fact that you're saying you're sitting with your patients for an hour is incredible. So sorry to interrupt you, but I just wanted to emphasize the
But
difference there.
thank you for highlighting that, because I can tell you that time, that secret ingredient that facilitates
Mhm.
healing, to be honest. Just having that freedom for someone to tell their full story, not be interrupted, not be rushed, just verbalizing that, putting it together, and have someone actually listen
Yeah.
to it in itself is so therapeutic. And I kind of joke about this, but not really. Is I always tell people, you know, one thing that I have in my office that I never thought that I would really need, and it's not a stethoscope or any fancy technology. It's a box of tissues, because I cannot tell you how
Aw.
many people actually cry, like leave the office. And I hope I'm not scary. I can assure you, I am not intimidating. It's not me.
You
I've
don't seem
confirmed
that
that.
way.
But it's just the having that time and space for the first
Mhm.
time for some of the people who have gone to
Feeling
20 different
heard.
doctors and feeling heard.
Yeah.
Exactly. And someone actually asking the question, you know, what does health look like for you? What brings you joy and happiness in your life? It's not just like, what's your lab test? You know, what's your CAT scan saying? So,
You're no
and
longer
it
just
works
a number and
both
a result on a
ways.
test. Yeah.
Exactly. So
Yeah.
I think that therapeutic relationship that starts with that commitment on both sides, it's a great foundation to build on. And I understand that this type of medicine might not be for everyone, because not everyone's there yet. And I get it. But for people who are there, this can be that light at the end of the tunnel, right? This can be
Yeah.
that answer that, yes, I can do more. I can play a more proactive role and be engaged in my healthcare than just sit here and wait for a diagnosis or wait for a pill to come around. You know, Western medicine is
Yeah.
amazing at certain things. I'm not saying we obviously love what Western medicine has to offer, but it focuses on a certain spectrum of health, right? That's towards the disease end. But there's years and decades of our life where we can really optimize our health, where we're not doing such a good job at. And we really need to use integrative medicine to get that done.